Should I get a neck lift and chin implant, or will just a neck lift fix my double chin? Would the neck lift fix my double chin, or would you also recommend a chin implant? Would I be okay with just a neck lift? Looking to get rid of my double chin completely and have a more defined jawline.
Thank you for your question. You submitted a single photo of a side view, and your question is, should you get a chin implant or a neck lift with a chin implant with the ultimate goal of having a more defined jawline? Well, I think that when you ask a question like this, you probably are not aware of other options that are also possible for you to help you with your desire for better neck definition. So, although you haven't stated specifically your age, it looks from the photo that you're relatively young, and the questions that we ask when we do an evaluation to ourselves and with the patient have to do a lot, all have an impact on the decision-making process of what procedure to choose. I'm a cosmetic oculofacial plastic surgeon practicing in Manhattan and Long Island for over 20 years. We do a lot of facelifts, neck lifts, neck liposuctions, and facial implants, including chin implants and submalar and cheek implants. So first, when we speak to someone who wants to have better neck definitions, we first have to decide about the age and skin quality. Why is that? Well, neck lift, the term neck lift is typically interpreted by a surgeon as a procedure where an incision is made slightly in front of the ear and mostly behind the ear to lift excess or redundant skin, sagging skin, and to also deal with platysmal or platysmal bands. That means that the muscle that's underneath the skin, where you get these little bands, or contributes to the sagging with facial aging. Now, this is a procedure that we reserve for people with that type of situation. So we would first evaluate and see, do you have extra skin? Or is the anatomy of your side view more a function of other anatomic issues? Specifically, there's a bone called the hyoid bone. The hyoid bone is what defines the neck angle. And for some people, it's low or forward, and other people, it's high and back. And there's always in the middle. So in determining whether or not a lift will do the job or what is your potential, the hyoid bone is very important anatomic feature to determine that. Because if you have a very low hyoid bone and it's very forward, then you have very short distance between the bone and the chin, which means when you pull up the skin, you're not going to get that much of a differentiation. Now, this is very important with people who have facial aging, because there is also kind of a downward descent and migration of the hyoid bone. So in consultation, we typically lift the skin to show the patient what is their maximum potential benefit, because they often look at friends who have had facelifts and they want to have a similar result, but if their anatomy doesn't allow for it, we have to communicate that. The choice of a chin implant, in other words, to add projection to the chin, is also not always straightforward. And this has to do with why the chin is back. Is it because it's relatively short, or is it due to the position of the mandible or the jawbone relative to the upper jawbone, the mandible and the maxilla? So a lot of times people who have the perception of a weak chin, it's because their teeth are actually relatively misaligned. It's basically, by doing a simple examination in the mouth, you can see if someone has a relative overbite and the chin is posterior. Now that's somebody who, if that's the case, if they were to get a chin implant, they would actually get deepening of an area called the labiomental crease, which is a crease between the lip and the chin. and that would cause it to look deeper and may not look very flattering. Now, in some people, it can be adjusted, and you can position the chin implant and choose a size that would fit that face if they're not interested in doing some kind of oral maxillofacial type of procedure. But you actually have to understand that. Now, in a situation like yours, where you might be a candidate for a chin implant, and you may also want to consider neck liposuction. Now, this procedure basically reduces fat along the under part of the jawline as well as below the chin if there's extra fat under the chin. But what we always have to be cautious of is not taking too much away. A lot of times plastic surgeons are very aggressive about removing fat, and we've had patients who came in who had to actually either get fat transfer to restore, or we did something to try to rehabilitate the skin. Because a thin layer of fat under the skin actually makes skin look youthful. You know, when you look at a younger person, that person looks young because of volume. And so if you take away that fat too aggressively, it can actually make them look older. Now, the last issue, of course, is your physical weight. Are you overweight? When a younger person is well over 10 pounds their ideal body weight, then a lot of times simple weight loss can actually help define the jawline and the neck. But it's important to at least entertain that before considering a more invasive procedure. That being said, you ultimately need to have a physical examination with the qualified and experienced cosmetic surgeon. The photo is helpful, and certainly it triggers in my mind certain questions to ask, but to make a recommendation that is definitive would require an examination. Remember, we talked about anatomic features such as the position of the hyoid bone, physical weight, the position of your mandible relative to the maxilla in terms of your bite, whether you have an underbite or a normal bite. So all those things are a factor before making this decision. So again, I recommend you meet with qualified, experienced cosmetic surgeons and see where you feel comfortable and explore whatever those options are, and you probably will want to get more than one opinion. And in the meantime, I wish you the best of luck. I hope that was helpful, and thank you for your question.